Hello.
Hi, Mr. Brown.
Hello, nice to see you.
My name is Cindy Brown, and I'm going to be your nurse that's going to give you your examination today.
Okay.
I want to ask a few questions first about your medical history.
All right.
I see from what you wrote down that you really had no issues as a child, other than normal childhood diseases.
Chickenpox, stuff like that.
Okay, and as you got older, I see you had some surgeries. Can you tell me about that?
2005, I had a single bypass open heart surgery. Back last February, I had a heart attack and had to have a stent.
Last February, meaning this 2013?
2012.
It was in 2012?
It was in 2012,
Okay.
not 2013, 2012.
Okay.
And then this year, in this past summer, I forget the actual month, August, I believe, I had to have my gallbladder removed.
Okay.
And that's all.
That's enough.
Yes, it is.
During your open heart surgery, do you know which vessel was occluded?
It was the artery that runs at the bottom of the heart. I don't know what the name of it is.
Okay. And what about the stent? Do you know?
That was in a vessel behind the heart. But
Okay.
I don't know what else.
Okay. And you said they put a stent in. Did they also do angioplasty?
I don't know what that is.
The balloon,
Yes.
when they try to open up?
Yes.
Okay. Okay. Any other surgeries or chronic illnesses? A chronic illness would be something like asthma or diabetes.
Don't have any of that. The gallbladder removal a few months ago, and that's it.
Okay. All right. Tell me what medications that you currently take.
I take Toprol for high blood pressure, 5 milligrams a day. I take Lipitor, 80 milligrams a day. I take something called Listeril, I believe it's called.
Lisinopril?
Lisinopril, yeah, that's it. But I'm not really sure what the dosage is, 5 or 10 milligrams, something like that. I take one baby aspirin, and I take an over-the-counter Provosec for stomach.
Okay, tell me about your stomach problems.
Many years ago, I had a ulcer and was also diagnosed with a hernia,
Tidal?
hiatal hernia, and ever since I think it's genetic. My dad ate Tums all the time, and so I just always had real bad acid reflux.
Okay. Is there anything else you can think of to tell me that would be important
No.
for us to look at today?
No.
Okay, what we're going to do now is I'm going to let you go into the exam room and get undressed, and then I will be in and we will perform our exam.
Okay.
Okay?
All right.
All right. You can go ahead and go. Patient appeared healthy. Normal gait when walking, needed no assistive devices. He had a great mood and affect. His age is 55, and I think he looks 55. There were no obvious physical deformities. General appearance, he had well hygiene. Clothing was casual, but appropriate for the season, and he was clean and neat. No disheveling.
Got some.
Okay, I am washing my hands. And we have privacy. I'm going to go ahead and get your vital signs first.
Okay.
Let's get your temperature. This will just go in your ear. $97.1. Blood pressure. Do you have issues with your blood pressure, with all of your heart?
Yes, I think the, Toprol.
That's also used on most people who have had heart attacks. It is what's called a beta blocker.
Well, I was taking that before I ever had an heart attack.
Okay.
For blood pressure.
For blood pressure.
Yeah. Long before I was.
Okay, this is going to be a little tight on your hands. $112/72.
Can't beat that.
I'm going to get your pulse, and if you would give me this arm, I'd like to do both of them at the same time. Okay, 76. So what I'm going to do is a head to toe, side to side, front to back assessment on you.
Okay.
Okay? I'm going to take the glasses off for right now. I am going to palpate your head and scalp. No abnormalities, no lumps. Okay? Now, I'm going to go through some exam to check your cranial nerves, your facial nerve. So I'm going to ask you to do some silly things, but just bear with me, okay? Would you raise your eyebrows? Okay, they're even. Would you show me your teeth? Okay, all even. Stick out your tongue for me. Okay, straight, no deviation. Close your eyes and let me, I want to check sensation, okay, from one side to the other.
Okay.
Now I want you to tell me if what you feel is sharp or dull.
Dull. Dull. Sharp. Sharp. Sharp.
Okay. Can you tell me what today's date is?
Friday the 13th,
What year?
2013.
Okay. Who is our president?
Barack Obama.
Have you ever had any issues with your hearing?
Yes.
You have
Ringing in my ears.
ringing in your
All the
ears?
time.
Okay. Have you seen someone about that?
Yes.
And what did they tell you?
They didn't really give me a cause. There wasn't anything they could do.
Okay. going to check your arteries. These are your temporal arteries. Okay. Let's take a look at your hands. Unremarkable except for some brown spots on both hands. I'm going to check your eye movement, and what I want to do right now is for you to follow my fingers in the direction that I move with them, okay? Good. Cardinal gazes are intact. I'm going to turn this light off for a moment. Shine a light in your eye. We have pupils round, equal, about 3 millimeters each, and we have positive accommodation. Okay, I'm just going to take a look. Red on both sides. Both sides look the same. Okay, let's look at your ears. I'm going to pull on the outer part of your ear and push in on this little area. It's called the tragus. You tell me if you feel any discomfort. Do you?
Mm-hmm.
No?
No.
Okay. Let me just go ahead and look inside the ear. Okay, unremarkable. Unremarkable. Any discomfort?
Nope.
No? Okay, good. Now, let's take a look at your nose. Everything is symmetrical. No deviation in the septum. I'm going to test your hearing.
Okay.
What I'm going to do is just whisper in your ear, and you tell me if you can hear me, okay?
Okay.
You tell me what I said.
I heard you said 1, 2.
Okay.
Nine, 10.
Okay, good. Pick out your tone.
Go.
Okay, say ah. Okay, uvula is midline, no deviations. Look at your chest. We have a scar, a midline scar. Brown spots, everything else looks good. Shoulders are symmetrical. Okay. I'm going to check your breath sounds. Turn over and let me check on that. Take a deep breath. Breath sounds are clear in all fields. With percussion, there is no abnormalities. Okay, I'm going to check your heart sounds now. Heart tones are loud. I hear no murmurs. It is regular. Okay, can you lift up just a little bit and let me check? Okay, turn onto your left side just a little bit for me. apical position was at around the 11th. I'm sorry, the 7th intercostal space, about 2 inches over to the left. Okay, I'm going to check your heart rate. Got an 80. Now let's take a look at your abdomen. Everything is symmetrical. The umbilicus is unremarkable. You still have the brown spots. I do not see any pulsations anywhere along the aorta. I'm going to check your bowel sounds, starting with the right upper quadrant. Bowel sounds are present in all 4 quadrants, slow in 3 quadrants, a little fast in the lower left quadrant. Okay, now palpate your liver. And what I'm going to do, I'm going to touch you kind of deep, lightly at first, and then deeply, okay? I don't feel any liver enlargement. Okay, turn over to your left side just a little bit. Not feel the spleen. Okay, I'll try to I'm gonna check for your kidneys. I do not feel the kidney. I'm trying to turn over this way. Okay, and check and feel your aorta. I do feel an aortic pulse. Okay, I'm going to check now the lower part of your body. We'll keep you covered here. Just have one leg out at a time. I'm going to check your groin for a pulse. And also check your lymph nodes. And I do feel an enlarged lymph node in the right groin. Pulses were present. Pulses are present. Lymph nodes on this side are unremarkable. Okay. Take a look at your feet. Legs unremarkable. There is no edema in the right leg. Leg unremarkable. No edema. I'm going to try to get your pulse behind the knee. We got it. Present and regular. Present and regular. Let's check the DP pulses. Give them probably a 3+. They're strong and regular. ET pulses are also strong and regular. And since I'm already down here, we're going to go ahead and do part of your neurologic exam.
Okay.
I want you to bring your toes towards your body. Okay, and then bring them back towards me. Curl your toes. Okay, good. Now, go ahead and curl them again, and I want you to pull against my hands. Good. Nice and strong. Okay, bring them back the other way. Now, push. Very strong. Very good. Okay. I want you to try to push up against my hand. Strong. Same over here. Nice and strong. Let's go ahead and check sensation, okay? I want you to tell me if it's sharp or dull.
Okay.
And I'm going to go from your neck down since we've already checked your face. Close
Okay.
your eyes.
Sharp. Dull. Sharp. 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 Dull. Sharp.
Let's do your nose.
Sharp. Yes, still, I don't feel anything.
Let's try it over here.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp.
Okay, we had all of them right. You had this one area here right above the knee that you weren't quite sure. Okay, I want you to squeeze my 2 fingers hard. Okay, good. Now, I want you to try to bring your arm down. Good strength. Good strength. Okay. I want you to close your eyes and take your index finger of each hand and touch your nose. Okay. Unremarkable. I'd like to get you up and walk.
Okay.
And that'll be the end of our exam. We will step out for a moment while you get dressed.
Okay.
Mr. Brown, walk just a little bit towards us. Stop. Now walk on your toes for a little bit. And then your heels. Okay, very good. Thank you. This exam,
Okay.
it was very nice to meet you.
Nice to meet you.
Hope to see you again.
Okay.